Here. All right, so
sure you don't want to do it awake. Like if awake, I only have to be awake half the time. I'll wake up every 20 minutes to do a check.
Okay. All right, everybody who's tuned into this live stream. This is the second public live stream that we're doing for the Crossroads Connections program to educate our staff and to engage with you guys and your questions and try to teach you a little something. This month's topic is suicide and suicide awareness. So what we're going to be doing here is talking a little bit about suicide, what sorts of things go into that, and then also what you guys should be doing as caregivers when that comes up, when that is something that you need to address. Okay, so let's see who's in the room here. Lasha is in the room, and seems like nobody else. If anyone else wants to participate in the chat, what we're going to do for certificates for this is if you guys tune in another time and complete a quiz that I'm going to put up afterwards, we'll consider that for your group supervision, and you'll receive a certificate for this. And also, if you participate in the chat and answer questions today, I'll consider that for a certificate as well. But we're going to get started on the PowerPoint content for people who are tuning in partway through. You guys can just catch up. Okay, so suicide awareness, like I said, we're going to be talking about the things that are in involved in suicide, and also talking about statistics and information about suicide. The nature of this training could be an emotional trigger for anybody for a number of reasons. Maybe you have a friend or a family member who's died by suicide. In that case, you may want to be cautious about this content. This content was originally developed for an in-person thing, so it says a skilled individual be able to talk afterwards to anyone who's emotionally triggered. If you guys who are tuning in would like to talk afterwards with me, that is a possibility that could arrange, or you could phone the office tomorrow and talk with Lasha. It's important that you guys take care of yourselves emotionally, so if you have any issues like that, you can access supports. So the first question is, what is suicide? Suicide is the intentional self-inflicted death. This is the act of deliberately killing yourself. It's a multifaceted and it's a complex issue. There's lots of things that go into it. And the first component we're going to be talking about is suicidal ideation. So this is ideas about death or dying. Maybe somebody's wishing that they're dead, or ideas about dying by suicide. These are not typically persistent ideas and are fairly common with people with a number of mental health conditions, or those who are in life circumstances that are particularly trying. Most people with suicide ideation do not go on to die by suicide, but the ideation is a risk factor in suicide, and it's something to consider as a skilled person in that person's life. It's persistent and strong thoughts. Persistent and strong thoughts of suicide are more of a concern than occasional or mild thoughts of suicide, and that is seems pretty self-evident, right? If it's persistent and stronger, it's more serious than if it's mild. So suicidal intent, this is a little bit more severe. This is you have the idea of suicide is better formed. It's more consistently held than suicidal ideation. A person with suicidal intent may think about dying by suicide lots of the time, most of the time, maybe, imagining what life would be like for friends and family without them around. The strongest intent occurs when a person decides that they will commit suicide, when that decision gets made. And then there's a suicidal plan. So that would be there's a clear plan now on how they will act, how the act of suicide will occur. Vague plans, if you were talking with somebody and their plan seemed really unclear, it was really vague, then that would be part of suicidal intent. You wouldn't consider that a suicidal plan. In a suicidal plan, the means of suicide will be identified and obtained, and the place and time will be chosen. And if this is something that you're dealing with, it's a psychiatric emergency and should be dealt with by hospitalization. So taking somebody to the emergency room, calling emergency services, that kind of response. The next thing we're going to talk about a little bit is some myths and truths about suicide that people typically believe. So some people believe the myth is that an individual is not really serious about suicide if they're talking about it. If they're talking about killing themselves, it's just like attention seeking. They're not really serious about it. But the case is that talking about suicide is an indication of a risk factor, and without appropriate intervention, it can escalate to making attempts of suicide or having a more thought through plan. Another myth would be that suicidal teens are just overreacting to their life events and don't really need to be taken seriously. But it's still the case that what is distressing to you, what's distressing to another person, is experienced very differently. Um, One of the examples that I like to give for that is when my mom was a young lady. She was in her teens. She and her friends were walking, and a man approached them and was talking with them, and her friend was very uncomfortable with the situation. The reason being that he had removed his penis from his pants and it was just out there. And my mom thought it was really funny. He must have made some sort of mistake. It's hilarious. But her friend, who had different experiences in life, found it just incredibly disturbing and incredibly destabilizing for her. Another myth that might come up is that suicidal behaviors are caused by talking about suicide. You might, there's a little bit of truth to that. Talking about the subject of suicide could increase the person's need to the way they're feeling or their need to act. But talking through it is also the way that you might reduce the risk that they may attempt suicide. And then another myth is that suicide rates are highest around Christmas. Rates of suicide are fairly consistent over times of the year. There's a little bit of an increase in the holidays, after the holidays in January, but not a really intense one. The reason we're talking about suicide is because worldwide suicide is the second leading cause of death among 15 to 29-year-olds. So that would be a lot of the youths that we work with are in that age range. It makes sense that old age isn't really a cause of death for this group. So it makes sense that accident and suicide are the main causes of death. In 2015, 75% of deaths by suicide were by males. If you guys want to make a comment about why you think that is, what you think the difference is there, I can come back to it and see if you're right. Oh, shoot. There we go. Yeah, so the question is, why do you think males are higher at risk for committing suicide? 75% of deaths by suicide were males. Suicide and motor vehicle accidents account for almost 60% of youth deaths. That makes sense. Like I said before, youths don't typically die of old age, and disease is rarer than those two events. This figure is globally relevant. Suicide is among the top 3 causes of death for young people aged 15 to 34. Lesbian, gay, and bisexual youth are at higher risk for attempting suicide. Uh, the difference being 28% of youth in that category attempt suicide versus 4% of their cisgender and straight peers. The other area is that transgendered youths also attempt suicide at a much higher rate than their cisgendered peers. So the language that people use around suicide is important because what we use as professionals to describe things contributes to stigma and taboos and making it harder for clients to open up to us. In the past, people have used the term like successful suicide to describe suicide or a committed suicide. Um, and even the term committed suicide comes from the fact that suicide used to be a crime. It was considered a crime. So if you commit a crime, you could commit the crime of suicide. That's no longer the case. Suicide is not considered a crime. And it seems really unclear to me if someone was successful, who would be held accountable for that crime. But what typically I would like you guys to say as caregivers would be died by suicide, would be the way to go about that. So Lasha has some answers to the question.
They're more likely to use firearms rather than overdosing on medication, just an idea, and other deadly weapons.
Okay, so Lash is saying that they're more likely to use firearms or other deadly weapons than things like medication. And that's pretty accurate. She's pretty right about that. Men have a tendency to use more lethal means of suicide. So like more lethal means isn't necessarily just firearms, though that is the leading cause in the States where there's a lot of firearms at hand. But the even like bigger, dramatic, lethal sorts of events like jumping off of a high object is a more lethal means. And girls and teen girls are less likely to do that kind of thing. In order to work in this field, it's important to understand these kinds of topics and not be afraid to learn about them. Talking open in a healthy way is always a good thing. It does not make talking about suicide with a client does not make death by suicide more likely. That's a myth that comes around, and it's not true. It is always best to address things frankly and compassionately. If you're talking to an overwhelmed client, you can always remember too that you can get help from the support system that you have as a caregiver for us, which is calling our on-call phone, calling people at the office, and then if it is a really severe situation, it would mean calling emergency services or calling mental health response teams. So here's a question for the group. What causes a person to be particularly vulnerable to suicide? What are the big risk factors that you might see? And while you guys think about that, I'm going to talk about some protective factors for suicide. So if you have a client who's displaying some suicidal ideation or has a suicide plan, you want to keep in mind some different factors that are protective. So good coping skills in general. Resiliency for that client in general would be a protective factor. Having self-control, not having a really impulsive attitude is a protective factor as well. Substance use, staying sober, that's a protective factor. If they're demonstrating good problem-solving skills, if they have a strong religious affiliation, that's also a protective factor. When you're talking to them, if they display hope and optimism, they have a supportive environment that they work in, if they have close social connections, close family connections, and responsibility, if they feel responsibility to other things. There's a famous case of a psychologist who, when he was intervening with a suicidal woman, whose name I don't remember, the way he intervened was he gave her a job. He said to her, your job now is to look through the newspaper, and every time that you find a funeral or obituary, your job is now to send that person an African violet and to give that to that person. And she took that really to heart, and she did it. She went through the newspaper and she raised African violets to send to all of the people in her community who had experienced loss in the funeral and at the funeral. And when they followed up with her years later, he asked her how she was doing, and she said, well, I'm doing great, but I can't take any time off. There's so many, I have to do all this work to raise these African violets. And what sort of resources they have access to is also a protective factor if they're well resourced.
She said not having any of those protective factors, and then Brooks put trauma and abuse.
Trauma and abuse is one of the potential answers, as well as not having protective factors, which I suppose is a is a risk factor. If you don't have any of those protective factors.
She said not having good coping skills, self-control, no hope, no optimism, no social connection.
All right, I feel like she kind of gamed my question there in saying no good coping skills, no good self-control, substance use, which is the opposite of these things. Yeah, it's sort of the case. Some other risk factors are recent publicized suicide. If you have a public figure who's committed suicide, that can be a risk for increase in suicide as a thing that happens across the board. Not having crisis resource information available. One of the risk factors can be, if you're evaluating risk, the sex and gender of the person. We talked about that already. Men and boys typically choose more lethal means. So that does not mean they're higher risk for suicide attempts, but they are higher risk for dying by suicide. Hopelessness, like Lasha said, no hope. Insomnia, isolation, living alone, substance use, history of mental health conditions, and one of the biggest risk factors is the presence of a current suicidal plan. Another very strong risk factor is previous suicide attempts, as well as being aware of availability of lethal means. So whether they have access to a firearm, whether they have access, whether they live like right next to a bridge, whether they have whatever lethal means is in their plan. Another risk factor is a history of childhood sexual abuse or physical assault, family history of completed suicide or psychiatric illness. And that piece is important because most people, or a lot of people, don't really consider suicide a viable option for dealing with their problems in life. But if you have a close family member who has died by suicide, that kind of opens it up in your mind a little differently, right? This is an option that people do. You know a person who did that. Anytime you're in a really big transition in life, or having like a physical disorder that has chronic pain or some sort of chronic condition that won't end, that would add to hopelessness.
Would you not said lack of confidence and abuse?
Lack of confidence and abuse. I'm not sure about lack of confidence, because sometimes the suicide, you can have people who are very confident and they choose lethal means and then die by suicide. But abuse is definitely one of the risk factors. Some warning signs you guys consider as well. So any of the following can mean the individual is at immediate risk for suicide. So threatening to hurt or kill themselves, this seems really self-evident to me. Threatening to kill themselves means they're at immediate risk, and that makes sense. Threatening to hurt themselves is a little bit different. What we did in the last group supervision live stream was talk about self-harm. So I'm just picking really cheerful topics to stream about. And that in that situation, there is like non-suicidal self-injury that could occur. And maybe that's what's being threatened there. Expressing interest in wanting to hurt themselves or kill themselves, if they're actively seeking and looking for a lethal means like a firearm or pills. If they're discussing or writing about death, dying, or suicide when this isn't like a typical behavior for that individual, when it's a change. Acting recklessly, engaging in really risky activities could be a warning sign as well. Previous exposure to family members who have suicidal behavior. Homelessness could be a warning sign. Previous suicidal attempts. Really intense emotional dysregulation, rage, anger, feeling trapped, that kind of hopeless feeling that just doesn't seem to go away. Increasing alcohol or drug use, withdrawal from family, friends, or society, maybe agitation or intense anxiety could come up. Dramatic shifts in mood could be a warning sign as well. If they're saying things like, I have no reason to live, or have no purpose, no sense of purpose in life. You also want to consider their diagnosis. If you're working with a client who has a particular diagnosis, they may be, some of them are more or less correlated with suicide attempts. It's also possible that these warning signs that you're seeing are part of another behavior pattern and not part of suicide. So that's something to be aware of as well. So if you were going to evaluate the risk for someone who was somewhere on this continuum of suicide and like the things related to it, it would be mild if what they had was just suicidal ideation that didn't happen very often or wasn't very intense, didn't last very long. If they didn't have an identifiable plan, if they didn't have any intent, if they were self-controlled, if they didn't really have any risk factors or protective factors, or had protective factors, that would be a mild risk kind of situation. You'd be thinking it was a more moderate risk if the ideation was frequent, and it was kind of more intense and more longer lasting. Maybe there's specific plans. some specific plans, but not really an intent. Maybe they have some risk factors, but they still have protective factors. That would be more of a moderate risk. So high risk would be, it's frequent and intense and enduring suicidal ideation. They have a specific plan or more than one. They have objective markers of intent. So they're doing some sort of preparatory behavior. Maybe they're saying goodbye to people. Maybe they're giving away gifts. They have access to lethal methods. That would be high risk. There's evidence of some sort of impaired self-control. There may be multiple risk factors present, and they maybe have few, if any, protective factors at this point. That would be a really high-risk situation. Imminent risk is frequent and intense and enduring suicidal ideation with a specific plan, access to a method, clear subjective self-report, and a clinical judgment would say there was intent. So they are saying that they intend to, and clinical judgment would say there's intent there as well. Impaired self-control and lots of risk factors, no protective factors, that'd be very high risk. If you guys are talking to someone who's expressing suicidal ideation, suicidal intent, it's really important for you to listen to what they're saying. It's important to listen to the person who's at risk. If you're in a trusted relationship with them and they're sharing their story with you, you need to allow them to do that. You don't want to minimize their feelings or experiences that are leading the experiences that are leading to their feelings, and you want to ensure that the person feels heard and understood. If they don't feel heard and understood, there's really no way for us to help them with the situation. They're just going to feel more isolated at that point. Individuals who are at high risk are usually conflicted about wanting to die. And it is the case that that kind of intense emotional dysregulation that goes along with a suicide attempt is not forever. The kind of intense, it feels like it goes on forever. And if you ask them if it'd be forever, they'd say, yeah, it's the only way to change it would be suicide. But the case is that it's not forever. It will ebb and it will flow. May come back, but it will go away. That's one of the reasons why impediments to suicide are functional. Like having nets on a bridge is functional because you have that impulse. The only way you can see to get out of it is suicide, and you start to climb, and then you can't get over something. You have some sort of obstacle, and at that point, it's interrupted the impulse, and it's given them a chance for that feeling to ebb away a little bit. It can be very difficult for an individual thinking about suicide to reach out and talk to someone. Sometimes they need help to do that. They need encouragement. They need it to be really clear that you're there as a supportive person. You can do this pretty clearly and pretty directly, though, by asking them directly, if they're thinking about suicide. That sounds like we have taboos about talking about suicide. So that sounds uncomfortable to just go up to somebody, and even if you're close with them, ask them that question. But it is important, and you're more likely to get clear and good information out of that than if you were to use euphemisms or beat around the bush about it. Mm-hmm. Asking about suicide. Once you ask the individual if they're having thoughts of suicide, you need to hear a yes or no answer. Essentially, anything other than a no should be considered a yes. If it's maybe a little bit, that's yes, they're having thoughts of suicide. If they provide you with a yes answer, that's kind of their way of saying, help, I need some help with this. People who are suicidal, the goal of suicide is not death. The goal of suicide is for their emotional state to be done, their pain to be gone. The goal is for them to feel better. And they don't think there's any other way. One of the things that you can do here too is use things like Likert scales, asking them, like, what do you think? How intense is this? How intense is your feeling? Or just asking, like, on a scale of 0, I don't want to kill myself at all, to 10, like I'm walking out the door this second to do it, ask them where they're at on that scale. And that can give you some pretty good information too. So you're asking the client, if you're in this situation, you're talking with someone who's you suspect is interested or is thinking about suicide or potentially has a plan or there's ideation going on, you want to ask them if they have a plan. You want to ask them if they have a timeline to go along with their plan. At this point, you're going to assess risk a little bit, and that means you might reach out for consultation with another person. You might reach out for consultation with the on-call phone or something, or even calling like another person who has more experience than you. But you can use your judgment and to determine the level of risk that the individual is at. If the individual seems to be at high risk, if they're at imminent or high risk, you want to stay with them, be there, supervise them, and it's for you guys as workers, you want to notify the family and guardian of the situation right away. Pass on all the information that you've gained regarding their plan. If the client is upset and needs help today but isn't at risk, what you're going to do is you're going to provide the family and guardian with resources such as momentum or drop in yay or other situations like that. There's also a possibility that you could book an emergency session at Kells, which is our sister company. Some of our supports can be accommodated. Some of our clients can be accommodated through that. If you believe the client is at high risk right now, you want to call 911 or call 211 to see if they can send the mental health crisis team. Contact the family and notify them that you've called one of those numbers, and contact your supervisor and on call and notify them of the situation right away. The other thing to remember, though, is when you are dealing with this kind of stuff, when you're talking to somebody who is really dysregulated, is really upset, that takes a toll on you. That's emotional labor. That's work that you're doing. So you need to take care of yourself as well. After you've made sure that your client is safe or they're with a guardian and you've done your responsibility, you've followed your responsibility, you want to take care of yourself. So talk with a supervisor. You might want to do some other sorts of emotional regulation skills. Take a break, go for a walk. Positive self-talk might be what you want to do. But overall, it's really important for you to take care of yourself. You guys can give me some examples of self-care techniques that you use. And that is the end of my content on suicide for today. I can address any questions that you guys have. If you guys have any questions or things you want me to address about your clients that you guys have now, I can do that now as well. Going walking is one of the things that Lasha has a suggestion for, and that's definitely a good one to do. Walking is pretty calming for most people. It's like that rhythmic side to side motions, just really calming. How can you help teach others self-care? hard questions. Teaching others self-care is kind of tricky because self-care is dependent on the other person, right? If you have, it's dependent on what that person likes, their likes and dislikes. Definitely you can do a better job of teaching emotional regulation skills to people. There's emotional regulation skills that work across the board. If you were to dump your head in some water, activate the mammalian diving reflex, that would calm you down. That would work. If you were to do some really intense exercise, that would work to calm a person down. That would probably change their mind and change what they're thinking about, including thinking about suicide. Yeah. So if you were working with someone who had suicidal tendencies or who was suicidal, you can model self-care for them. You can say, this is what I do to help keep myself, calm. These are the things that I do that work for me. And then invite them to join you in that. Invite them to join you in physical exercise. Invite them to join you in going for a walk. Regina's suggestion of taking a shower, I would do by myself, though. I would do that one as a solo activity. All right. I think, unless you guys have any questions about your clients that you'd like me to address. Oh, eat chocolate, Lasha says. That is good too. People like chocolate. Often a suggestion that I get when I do this sort of presentation in person is drink alcohol. I wouldn't suggest that as a great coping strategy. It's not going to help you a whole lot. It will, in fact, it will probably hinder your ability to process your emotions. When you're drunk, you don't really process your emotions. You do forget them for a bit. Those intense emotional experience goes away for a bit. That's why it's kind of activity that's why it's reinforcing, is because it takes away that pain. Okay. Right. I am going to sign off, but anyone who wants to do the quiz or watches this video later and follows through and does the quiz will get credit for participating in this group supervision. Sorry. 6 yes. I don't know what that means. I'm not familiar with 6 yes, whatever that is. Yeah, going shopping is also a good thing. If that is something that works for you, that would probably make it worse for me as a person. But if shopping is part of your self-care, that's awesome. So yeah, anyone who's watching the video who follows through and does the quiz will receive credit for doing this video. And I'm gonna say goodbye.